If you're a retired nurse or a nurse, you know a nurse that's retired, listen up. Lexington Medical Center has a new program that can use your expertise and your experience. It's called Nightingales. It is a volunteer-based program that aims to improve patient safety. Sarah Martin, she is with Lexington Medical Center. She's a clinical specialist. And we also have Kim Master. She's a retired nurse practitioner and a volunteer for Nightingales. They're joining us today to tell us more about this amazing program and how it works. And if you're a retired nurse or know one, maybe one for you. So ladies, thanks for joining us.
You're welcome. Thanks for having us.
Thank you so much. So Sarah, tell us about the Nightingales program. I know it's fairly new, starting in the fall.
Yeah, it's a new program. It's an innovative program geared towards retired nurses with the aim of improving patient safety.
I love that. And where did this idea come about? Have you had any retired nurses seeing if they can come back in? Where did you all see the need?
Well, Lexington is always trying to improve patient safety, and falls is one of those metrics that we're trying to improve. And so we're trying to be innovative in our approaches. So this was a new idea that one of the nurses at the hospital saw at a conference, and we wanted to implement it. And so we started this fall. We trialed it on several of our units and found after implementation that it had reduced falls by 50% on those units, which is a really significant number.
That's remarkable. Yeah. And Kim, how long were you retired before you jumped back and helping out with Nightingales?
I took a 10-year break.
A 10-year break, but you know, you love what you do. You know, even if you retire, you don't forget anything. You still have those skills, and this is a great way for you to still utilize those skills. So tell us, why did you want to volunteer?
Well, I miss, the patients, and now I've got the time that I can spend the time with the patients that, I'm not limited anymore. It makes it so much, and plus I get a little bit of continued education with what's new.
Right, and you don't have to be there every week. I mean, not every week, but you don't have to be there every single day, because you volunteer once a week, correct?
Correct.
And I want to ask, how often can people volunteer? Can they volunteer, is it just once a week, or is it every day, or how often they choose to volunteer? How does that work?
They could volunteer at the frequency that they're comfortable with. Typically, they volunteer for about 3 hours at a time, so it's not a huge time commitment, but it has really been impactful on patients and their safety.
And it's not just limited to registered nurses, it's LPNs and other nurses as well.
Any nurse that has been anybody that has been in the field of nursing, yes, that would be who we're looking for.
Wonderful. And what are the specific jobs and functions that you serve? Like, how do you assist?
I go to door, check on the patients, make sure they're not climbing out of bed, offer any help if they want something to eat or drink. I'm there. If the family needs something, I'm there. I just make sure they're comfortable.
Now, are there set hours for this? How many hours would you say you do on that one day that you go?
I do 4 hours.
4 hours. So it's not a very long shift, and could they do longer if they like?
I think most of the shifts are 4 hours. That is certainly something that could be discussed. I don't know that we've really gone longer than that, but might be worth investigating.
Could be, and maybe someone that's watching this like, you know what, I can do 8 hours. Let's go ahead and see how far we can go with that one. I want to ask both of you, what was it about, helping people that made you want to become a nurse or work in the field that you're in? Kim, I'm sorry.
I just enjoyed helping people. I've always been fascinated by the practice of medicine, but I like spending time with the patients.
Love spending time with patients. What would you say is
the same? I enjoy patients and helping them. I have always enjoyed going to work and making them better, so that when I left work, they were in a better place than they were when I arrived.
Yes, and what would you say the response has been from the other medical professionals that are working in the field? Has it been a great help for them as well, would you say?
They love it.
Yeah.
They like having the extra help checking in on patients and making sure all of our fall prevention technology is in place, and they just kind of fold the volunteers into that LMC family. So
Wonderful. And if anyone is interested in volunteering, where can they go for more information, and how do you go about selecting who's a part of the Nightingales?
They should contact Volunteer Services Department at Lexington, and the number is 803-791-2573.
Awesome. And that number is also right there on your screen. Again, Nightingale, this is a wonderful new volunteer program for retired nurses that the Lexington Medical Center is implementing. So if you, again, know someone that's a retired nurse, or maybe you are yourself and you're interested in helping people, continuing to help people, you can dial that number on your screen and you'll be connected. We'll have these details on our website, SodaCityLive.com. Until then, we're going to take a quick break. We'll be right back with more. Ladies, thank you so much for joining us, and thank you so much for volunteering.